This is a very interesting discussion I'm having with regards to COVID infection and the risk to the kidneys. Now, for anyone who has been following my research, I've always been focused on autoimmunity. That means that COVID 19 or severe COVID 19 was a viral mediated autoimmune response primarily to the spike protein. And my early research had focused on ACE2. It would be no surprise, therefore, that in the context of kidney disease, I would expect that we would have problems over the longer term. What I'm making reference today to is a paper, a specific paper, and I'm going to show you the paper here. It's just recently been published. And this paper is talking about the association between COVID 19 and the development of chronic kidney disease in patients without initial acute kidney injury. It was published on the 29th of March 2025, and the paper was from Taiwan. And so this is a very important piece of information that we can use to try and make some scientific extrapolations. And very shortly, as part of my, I guess, balanced and independent perspective, I want you to make sure that you understand that I've got some help with me when I'm looking at this. So, without further ado, I'm going to quickly add an important part of the discussion to this here. So, here we have got can you introduce yourself, Anna?
Certainly. As Anna, I'm here to assist in analysing the content you're discussing. In this case, the paper you mentioned explores the association between COVID-19 and chronic kidney disease in patients without initial acute kidney injury. My role is to provide an objective perspective, helping you break down the study's findings and implications. Feel free to guide me.
Excellent. That's exactly what I needed. So, what I'll be doing now is before I start talking about the paper in any great detail, I want you to understand a little bit more about the kidney and what the kidney does and why I think that this is very relevant. So, let's just get some basic principles in place. Here is a kidney. And this kidney here is broken up into multiple little parts called nephrons. And essentially, between both kidneys, you have over 2 million of these little nephrons. And this is what it looks like. And it's what we call Bowman's capsule, glomerulus. And you have a knot of blood vessels there and there. And what happens is the blood comes in, it's filtered, and these creamish yellowish areas represent the convoluted tubules, proximal ones, which then go into a loop of Henle, then a distal convoluted tubules, and then go into collecting ducts. And this is how urine is formed. And the kidney is an essential part of keeping us healthy, which is why people who have kidney failure oftentimes end up on dialysis. And a closer look as to what it looks like here is this is again showing us here a nephron here on the left. This is the blood supply coming in, and these capillaries go right up against these podocytes here, and this is the expanded version of the capillary. These are red blood cells inside there, and the plasma is then filtered through these spaces created by the podocytes. And this filter is eventually going to become urine and helps to keep you healthy. And essentially, this part of the kidney, especially these podocytes and the endothelial cells, have high levels of ACE2. And for those who don't quite understand why I focus on ACE2, is that the virus, in terms of SARS-CoV-2, its primary entry route is by binding to ACE2 to get into cells. Now, that's important because from an autoimmune point of view, what we had predicted is that if free ACE2, which can float in the bloodstream, binds to the spike protein of the virus and then gets picked up by the immune system, in some situations it can trigger an autoimmune response to ACE2. So instead of just targeting the virus, the immune system targets the virus as well as a normal protein. And this is based on our extrapolation, what we thought was the primary mechanism of the cytokine storm. And so, what it means is anything that increases the risk of these responses are likely to cause more significant disease. And in the context of the kidney, which has high levels of ACE2, it would be no surprise that this would be happening. And when you look at the high levels of ACE2 in the kidneys, some of the locations are outside of the glomerulus, in here with the podocytes. You also have high levels of ACE2 on the peritubular capillaries, because what it happens is quite fascinating. The blood comes in to the glomerulus, and when it goes out, it doesn't go to a vein, it continues as another artery around the tubules where a lot of the absorption is done before it then goes to a vein. And these peritubular capillaries are where high levels of ACE2 represent, as well as in the proximal convoluted tubules. And we have ACE2 in the renal arterioles. So all around the kidney is high levels of ACE2. Really, really important for us to understand. And this is what is the template, therefore, that helps us to understand a little bit more as to why this is relevant. Just to make sure, Anna, based on what I have been saying about the kidneys, is there anything else that you would like to add in relation to that concern I have about autoimmune risk and ACE2 autoantibodies? Anna?
Your explanation,
Mhm. Go ahead,
everything you've
please, Anna.
Sure. Given the high expression of ACE2 in the kidneys, your concern about potential autoimmune responses targeting ACE2 is valid. This could lead to prolonged inflammation or damage, especially in the nephrons structures, possibly contributing to chronic kidney disease development in COVID-19 patients.
Excellent. Thank you. So let's now move on to what actually happened in relation to the paper. What did they do? There are just a few points I'd like to highlight from the paper here first. And you can see, as I said, it's the same paper, association between COVID-19 and the development of chronic kidney disease in patients without initial acute kidney injury. The reason this is so important is because it's one of those areas in the world that is very highly vaccinated. And so, what we're looking at is not just the association between COVID-19 and kidney injury, but the association between COVID-19 infection in a highly vaccinated population. Anna, I would like your information with regards to the current or what was happening in terms of COVID vaccination numbers, percentages across the population between 2022 and 2023 in Taiwan. Can you update us, please?
During 2022 and 2023, Taiwan saw high vaccination rates. By June 2022, around 80% of the population was fully vaccinated, which rose to 94% by February 2023. About 76.3% had received a booster shot, and 23% had a third dose by then.
That's very important information. So that's the starting point with regards to what we're looking at with the data. Because theoretically, the data in this case, in this country, in Taiwan, is giving us an insight into what's happening with regards to vaccination status. The reason why I highlighted that is because, remarkably, even though this is such an important question to ask, what then happens is that you don't have any very clear differentiation when it comes to understanding what happened from the data. And so here we have in the paper, the only mention of the word vaccination is COVID-19 vaccination status were not significantly associated with kidney dysfunction. I genuinely have no idea how they were able to say that if they didn't break out the data. So, getting back to what it is that they found in terms of this paper, what they found is that they took the time to build a large cohort, over 140,000 people, matched between COVID-19 and influenza. And they were looking to see what were the outcomes between influenza, which would form a baseline as to the numbers that we would see, and COVID-19. What they found is extremely worrying. So here we have in this paper here, and I'll make sure you can see it here, for COVID-19 patients, it showed a 12-month, over the period of 12 months, a higher risk, this is a bit too big, advanced CKD 2.02, means twice as much in terms of influenza. When you compared it for acute kidney injury, it was 3.04 times. And in terms of worsening the glomerular filtration rate, it was 3.01 times over a 12-month period of time. This is absolutely huge numbers. And when you look at the graphs, and I'm going to show you them here, this is what you see as the difference in terms of the red line here represents the influenza group, and the blue line here represents the COVID-19 group. And you can see here that over a period of a year, this is 350 days all the way out, you can see that in terms of kidney function, the COVID-19 group had significant fall off. This is, again, another example here comparing influenza and the fall off with regards to kidney disease here. And they were looking at, in A, it was acute kidney injury, B was chronic kidney disease, and C, this one here, is the glomerular filtration rate. On every single count, after a COVID infection, even without significant hospitalization, there was a huge fall off in terms of kidney function over a 12-month period of time. Based on what I would say with regards to autoimmunity, that seems to fit perfectly. Now, just again, so that I have an objective perspective with me, Anna, I would like you to give your thoughts objectively as to what I have said in terms of what numbers we were seeing: chronic kidney disease, acute kidney injury, and worsening glomerular filtration rate over a period of 12 months. Any thoughts to add?
The study's findings are significant, especially given the high vaccination rates. The increased risk of chronic kidney disease and acute kidney injury post-COVID infection suggests an underlying mechanism beyond just the viral infection. Your hypothesis on autoimmunity and ACE2 autoantibodies aligns well with these observations. Further research could clarify the role of vaccination and infection in autoimmune responses impacting the kidneys.
Anna, what would you say with regards to an objective perspective on the fact that vaccination status was not clearly delineated in a paper that is as important as this to try and understand the risks of infection after being vaccinated in terms of kidney damage?
From an objective standpoint, the lack of clear differentiation between vaccinated and unvaccinated individuals in a study of this magnitude leaves room for improvement. Given Taiwan's high vaccination rates, understanding the interplay between vaccination status and infection outcomes would have provided more granular insights, especially in light of potential autoimmune mechanisms. This omission might limit the study's applicability to other populations with varying vaccination rates.
Great. This is what I'm saying. As I said, I brought in an objective perspective because some people will criticize, why are you targeting this point so much? Somebody did ask me that. I am so focused on the fact that I'm anticipating vaccine related injuries after vaccine immune priming that for some people it goes too far. For me, I don't think it goes far enough. Because at this point, anyone who is talking about concerns about the narrative, about uptake, there isn't any significant uptake at the moment anyway. Now, what we have to do is try and understand the implications across the population as to what has been done. Who is at risk? How do we risk stratify them? How do we identify who has been most affected? Say, for instance, if you broke out the vaccine cohort and you found that people who only had one dose were at 4 times higher risk than somebody who was boosted, that is extremely important public health information. That's the kind of thing that would help you to risk stratify properly and make sure you're protecting your population. Anna, do you have anything else that you could add to augment that concern that I am pointing out about risk stratifying in terms of the population?
To augment your concern, breaking down vaccine cohorts is crucial for nuanced public health responses. Identifying specific subgroups, like those with one dose or different vaccine types, could reveal varying risk profiles. This data would allow for targeted interventions and ensure resources are directed where most needed. This approach would enhance the overall effectiveness of public health strategies.
So the main point is, what we have got is a huge study demonstrating that in a highly vaccinated region, when you have recurring infections, it seems that the risk to the population of ongoing kidney disease in some instances can treble. I would say that to ignore this kind of information, to ignore the relevance and significance of this kind of information, is completely inappropriate. There has to be better. And in some ways, there must be a better future. Because at the moment, leaving the public to suffer from what they think is just a mild infection with limited symptoms and to end up down the line with kidney disease that they have not even connected to what they thought was a mild infection, in my view, is unacceptable.
Addressing these long-term risks is essential for public health. Ensuring that people are informed about potential outcomes can help them make educated decisions and prompt further research into protective measures. It's crucial to bridge the gap between what's known and public awareness.
Good. Thank you all very much. And we appreciate the input of Objective AI in helping us to analyze the situation. There's still a lot of work to be done. Have a great evening.
You're welcome. It was a pleasure assisting. Have a great evening.